Calgary, McKay, Nose Hill.
Thank you, Mr. Speaker. The public fatality inquiry report into Betty Anne Gagnon's tragic death included several recommendations to improve outcomes for persons with developmental disabilities in rural communities. Recommendation 6 was to review and ensure that there are adequate programs, including transportation for persons with developmental disabilities who live in rural areas. To the Minister of Community and Social Services, what has been done to start the review, and when will Albertans see improvements from the review?
The Honourable Minister of Community and Social Services.
Thank you, Mr. Speaker, and thank you, Member, for the question. Betty Anne Gagnon died in horrible circumstances, and my thoughts are with the family and those who are grieving Betty Anne's loss. Since 2009, we have made a number of changes that will ensure that we can avoid similar incidents from happening again. That will include changes in file closure policy, changes in transfer policy, and we are also planning at launching a helpline where Albertans can report such incidents.
Honourable Minister, first supplemental.
Thank you, Mr. Speaker. Given yesterday, the Minister said communication and coordination has improved by not requiring clients to reapply for services when they move, which is great, but that there's still more to do, and given the report notes these changes do not address long waiting lists, lack of backup plans, lack of respite options, and lack of resources for service providers to plan, train, or offer services proactively, when will the Minister when will PDD services no longer be confusing and no longer require strong advocacy for vulnerable people to receive services?
Honourable Minister.
Thank you, Mr. Speaker. We are absolutely committed to providing services to those who rely on these services, and that's why we have added $150 million to this program. We have heard concerns with respect to access. That's why we are moving ahead with the review of the program, which will help us look at the access to this program, look at outcomes of this program, and look at engagement means that how we can better engage with the community, with individual advocates and service providers.
Second supplemental.
Thank you, Mr. Speaker. Given the report detailed numerous times that frontline workers, family members, and service providers had the chance to intervene in Betty Anne's care, but very tragically did not, resulting in isolation and stress for her family caregivers beyond their capacity to cope. To the same Minister, what are you doing to protect and improve services for Albertans with developmental disabilities and their caregivers, regardless of whether they have formally requested services from your department?
Honourable Minister.
Thank you, Mr. Speaker. And let me begin by saying that no Albertan, no one should go through the circumstances that Betty Anne went through. There has been changes, recent changes, which ensure that families are part of the planning process and risk identification is part of that planning process. At that point, we can prioritize, identify the risk, prioritize the needs, but we will work with our community partners on all these recommendations. As I said, some improvements have been made, but review will be an opportunity.
Thank you, Honourable Minister.